Hello, I'm Robert, a science blogger and fact checker, and helping people who are scared of many things. And this is to help those of you who are worried about the situation in the United States with COVID-19 and in the United Kingdom, and the way the numbers going up, and then we have these seeming lockdowns, and you get people worrying that lockdown's going to just go on and on and on and on. So the situation is actually looking very good. And I want to, the vaccines make a big difference, but we can actually stop it without a vaccine. And it's very important to realise that. And once you realise it can be stopped without a vaccine, it helps to understand that with a vaccine we can stop it much faster than you would think. Much faster than you would if we couldn't stop it without a vaccine. So this is in New Zealand, and a lot of people in the United Kingdom, United States, are very surprised by this when you show them this picture of a packed stadium, and this is October the 11th of this year. And this was a rugby match between New Zealand and Australia in Wellington Stadium. You see no mask wearing, no physical distancing. The reason is that New Zealand has got rid of the virus. It just doesn't exist in New Zealand anymore, except in quarantine centres with visitors from other countries. That's the only way it's going to be there. You just don't have to worry about it. Now, this isn't surprising if you're like me and you've been following the WHO right from the beginning. WHO, all the way back in January, was saying we can do this. Then became really clear in February, by 25th of February, when 13 world experts and 12 Chinese experts toured to see how China had done it. And the report from that was absolutely clear. Any country that wants to can achieve this. What's required is a very systematic, very rigorous application of the tools that we already have. Now I've got a page here with the tools. These are the tools we need. We have them already. And Maria van Kerkhove, who is the COVID-19 lead with the WHO, she says that this is like being a Superman. But we don't have magical powers, they're practical powers. They're practical things. And she thinks of it like a toolbox. She talks about like her son when he, a young child's son, when he goes off with his pack to school or whatever. Then it's like he's got this toolbox on his back with all these things that he can use, and he's like a little Superman. And or like a superhero, sorry, not Superman, superhero. In this case it's Spider-Man, because he wears a mask, so Spider-Man has become a kind of bit of an icon for the mask wearing. So these are all the things we can do. The face coverings, contact tracing, which is that was a key to China's success. The quarantine, and the proper rigorous quarantine, hand hygiene, vaccination, mass testing, and physical distancing, which is very, very important. Even if you've got a mask, you should also do the physical distancing as far as possible. The mask, now the mask the WHO thought it was a few percent in their review a month or two back. The CDC, looking at some other recent research in the United States, thinks that the face covering may actually, even as used by the general public who fiddle with the front of it, they don't use it properly at all, and an ordinary fabric mask, it still seems, according to some of the studies the CDC have looked at, but they're only observational, they're not tests, they're not double blind or anything like that. You can't really do that, and it's not they haven't tested people in the same situation because that's unethical. But the observational things is that they think that face coverings may reduce your risk of getting COVID-19 by 70%, and your risk of transmitting it. They think it works both ways. This is fairly new research in the last month or so. Now we have to see how that works, but if it does, then that is partly why Biden was saying everyone's got to wear masks, because in the United States of America, their most recent research suggests it might be actually more effective than people have realised. So, but you have to do the physical distancing as well as the masks, and so if in a COVID-19 ward, if they wear masks properly, they wear the visors over their eyes, and they only do droplet protection, they're not protecting against aerosols, then they are able to be completely protected, to all practical purposes totally protected. The WHO gave this advice again in January, February, and ever since then health workers use personal protection equipment, and they don't have aerosol protection. They just have droplet protection. For aerosol protection, you'd have to have the sort of gear that they wear in intensive care units, and that has just not been proven to be needed in a general ward. And for the only reason they need all that gear is because they have to be up close to these people. And if you stay 1 metre away or 2 metres away, it depends what your government says, but the main thing is to step back when you're talking to someone, then that provides the same amount of protection as all that gear. If you're because it protects against the droplets, and the droplets just don't go that far, although the aerosols do. So it's really, we've got all these very, very good tools we have. Then we have the tracing, and then we have the quarantine, and that is how New Zealand was able to achieve that. But you've got to use these tools systematically and rigorously. And then they also did some lockdown. So lockdown is, the WHO don't use the word lockdown, but the stay-at-home orders. Then the situation is, it's understandable why the United States has to use stay-at-home orders. If you look at some of these numbers, so look there, 1 in 9 people in Burleigh County in North Dakota are cases. So contact tracing, when you get an outbreak as big as that, 1 in 9, then 1 in 9 people are infected, and 1 in 800 have died. In some areas of the United States, it's 1 in, if I go around here, I think down here, there's one that's 1 in 202 in Dickey County. 1 person in 200 has died. Probably they had some more elderly people there or something. That's very high. And so it's really, and some people I help are in these very badly stricken states. And North Dakota got a big surge just recently. All the way through the first wave, the second wave, and it's only in the third wave that it's had it, because it's a very rural area that people tend to just skip by and didn't really get hit. So, but in those numbers, 1 in 11, 1 in 9 people have got it, then contact tracing isn't really going to work. So, because because just about everyone will be a contact. So, in that situation, stay-at-home orders do matter, do make sense. That's the only situation where the WHO say that stay-at-home orders make sense. If you go to somewhere that's much less, like here, let's see what it is, 1 in 100. So say you've got 1 in 100, then each contact has 20 contacts. Each case has 20 contacts. If they all quarantine, then that's much less than 100 people staying at home. And the lower the numbers go, here where you've got it seems that most of US does, but if you go to the best cases, where that 1 in 200 people, then that's 20 out of 200. So, but I mean, most of the United States is at this level where 1 in 20 people, 1 in 20 people or less, and stay-at-home orders actually make sense as the way to control it. But they don't necessarily have to go all that way. So I want to explain a little bit more about why they generally tends to be stay-at-home orders. The contact tracing really is when you've got less than 1 in 20, 1 in 10, then it makes a big difference. I just want to explain now about how it's just very, very little is needed to take this over the edge from to make it start going down instead of up. This is the United States, and I'm pleased to see that we now have 1, 2, 3, we have 6 states that have an R naught less than 1. That means the cases are going down. It was only 2 yesterday, I think, the day before, and now it's 6. So now is this number R naught? If it's 1, if it's above 1, the cases are going up. If it's below 1, the cases are going down. And you can see that many of the US states are just slightly above 1, 1.0, I'd have to get my glasses on to read that. Let's see. (1.02) for instance. So 1.02 means that if you could stop 2% of the transmission, then that would go down below and they'd be going down instead of up. So it's really makes a big difference just to do a tiny, small measures. For instance, if everyone there wore masks, then that would, I mean, it's probably not 70%, but that seems a little bit, seems a little bit incredible really that it would be 70%. It may be just particular situations, but if it was really 70%, then they'd be going on very rapidly if everyone wore masks. But it seems more likely it's not quite as big as that. But everyone wearing masks, fabric masks, and using them properly would make a huge difference. Especially the states are just 2% over, then that by itself might be enough. And everyone doing physical distancing, if they did that really systematically and thoroughly, that would make a huge difference. Then once the cases per day have gone down, and quite a bit, then stepping up on the tests, fast testing makes a big difference, no matter how many cases you've got per day, because then you can isolate the cases very quickly. And then contact tracing, then that makes a big difference, especially once the cases per day have gone down, and it's less overwhelming for the number of contact tracers. Now, I want to show you how much the states have controlled it. Look at Alabama, for instance. This is what our note was originally. I'll probably have to get my glasses on again for that. Does it say? Not sure it even says. Oh yes, there we are. It was 1.9 back then. So, and the very highest numbers, California back then, it was even higher. Let's see if I can get that. Oh no, it wasn't so high. Oh yeah, 2.2, right. And in all those cases, that was still a bit controlled, because the uncontrolled is usually about 2.5. So these states, that is what it's like when it's uncontrolled. And they've brought it down from over 2 down to 1. And then sometimes it goes down a bit below, and then it goes above, goes below, and goes above. Whenever it's below 1, it's going, the cases per day are going down. When it goes above 1, it's going up. If you could keep it below down consistently, cases would go down and down and down until they're all gone, and there are no more cases. If you have it above 1, cases go up and up and up until everyone's infected. So the higher it is above 1, the faster they go up. But if it's above 1, then it's getting more and more out of control, and then it gets harder and harder to stop it. And basically what has happened in the United States is that it was below 1 in the summer, then it gradually went above 1, and so it's been getting worse and worse and worse for several months. And that's why if you keep up a number like that for several months, then it just gets out of control, and it gets harder and harder to control. So, and you see these ones are the ones that got it worst, right up there. But even that, even the worst is 1.34. Now 1.34, which is it's now New Mexico, it jiggles around sometimes which is the worst. And then the next worst is New Hampshire, and then it's Washington. It was different ones a little while back. So this jiggles around from time to time. But the even 1.34, look at that compared with 2. It's just gone down from above 2, mostly, or close to 2, down to 1.34. And then you just go down another 0.34, you see. Even there, it's not like a huge thing they have to do. So, remember we've got all these tools in our toolbox, and even just using the face coverings systematically, using physical distancing systematically, using hygiene well, and then once the numbers going down, and you can testing makes a big difference. Mass testing, we can do that straight away, and the contact tracing is going to help. And maybe even though you can't contact trace everyone, contact trace as many as you can in the areas where you can, and that will help. So if at the moment when they're not doing stay-at-home orders, and especially, and then we stay at home because they keep people away from their household as well. They inform people to stay away from their household because they have contact. So we've got all these things in the toolbox before we need to add the vaccine. So that is what I want to say. That's why it's so hopeful, because they're so close. So we've got all these ways we could, with doing everything systematically and rigorously enough, we could definitely bring it down below 1. And if we did it really systematically, like New Zealand did, we bring it back down. New Zealand brought it down to about 0.4, well below a half. And when you do that, New Zealand reduced it tenfold, the cases per day, in about 3 weeks. So that is definitely feasible, if you can bring it down as far as that, and again without a vaccine. So now we've got this wonderful news about these vaccines. So we've got Astrazeneca, which is vaccine for the world, is effective, and this one, it's 90%, rather strangely, it's 90% effective if you start off with a half-strength dose first, and then you have a full dose a month later. And they don't really know yet. They have to investigate and find out. He said Sarah Gilbert just said, she's an expert on this, said it's would have to be more closely studied to be fully understood, but the first half dose might be priming a person's immune system just enough that the second booster then encourages the body to produce a robust defence. That's not really explaining anything. In a way, it's just describing what happened. But it seems like a slight boost of the immune system, and then a big boost later on seems to be more effective. They don't really know why that is, so they have to investigate that. But that's very good, excellent news, and 90% is going to make a huge difference. There we are, because this is by far the lowest cost of all the ones so far. You look about a few dollars per dose instead of tens of dollars, and it's also one that can be kept in fridges, and they have committed to produce it at zero profit, with their accounts audited by Oxford University, made that a requirement. So AstraZeneca, it's really very, very promising that they've produced theirs. But then if you look at the total, I forgot the page thing about this. The total, no, I'm not sure if it's on this page. I'll just talk about it. But if you look at oh yes, I've got a bit about it. Let me see if I can find it. Right at the end. Or you just briefly talk about it. Yes, and there's a page about it. Vaccinating the world. So we can vaccinate 2 billion from AstraZeneca, another 1 billion to 2 billion people from Pfizer and Moderna. That's already more than, 2 billion, 1 billion to 2 people. If it was 2 billion, that's already more than half the world population. And we have a fifth of the world population already virus-free. And then we have 11 vaccines in total. And there's another one, CureVac, is another messenger RNA one. And then we've got, so if we look at the other ones, and typically each new one brings more, these are all the ones in trial. And then if we look at them, if I kind of zoom in a little bit to make it easy to see, and that's it. We don't really know about inactivated viruses yet. So we've got 4 inactivated viruses, 3 from China. We've got the AstraZeneca one, which is a non-replicating viral vector. That's a virus with a bit stuck onto it. There's another one called CanSino, and that's the Chinese one. So we can expect that to have similar results to AstraZeneca at a rough first guess. We have we also have the Russian one, which has already provided good results already. It's already provided more than 90%. So for some reason theirs is better than the AstraZeneca one, which is for some reason with much more limited data. And then we have the and then there's another one from the Johnson & Johnson one. There's another one of the same type. So we have 1, 2, 3, 4 of those, of which we have one that we have 2 that are showing very good first promising results. So quite likely the other 2 do as well. So then we have Novavax, which is which just produces nanoparticles of the spike protein, if I understand right. And so that's not tested, but it seems very likely, because basically the messenger RNA vaccinates you by stimulating your cells to produce these nanoparticles. This is injecting the nanoparticles directly. Seems quite likely that'll produce good results. Then there's another BioNTech, which is another messenger RNA one, and then we have the Beijing one. Now wait a minute, it's a replicating virus. That's the same as that's not in phase 3. So apart from the 4 inactivated virus ones, the rest of them are all using very similar technology of targeting the spike protein. So depending on how the inactivated viruses work, it really does look, but I'm not an expert. I want to make absolutely clear, I'm not an expert, I'm just giving you a rough idea. But and if any of you are experts, and if I say anything is anyway mistaken, please call me out on it and say in the comments. But just as a layperson, look at this and give me a rough idea. Then if you look at that, we've got 4 of those that have similar technology, and then we have all the another 4 of the similar to Astrazeneca, and then we have the Novavax, which is rather similar, and we have the Moderna and mRNA ones, and I think we've got 4 of those, or something like 3 of those as well. I'm not sure if that doesn't quite add up. So three of the adenovirus ones, I think. Anyway, so you can see that quite probably it's quite possible that all 11 of the ones in phase 3 are approved and are successful. Now, I wrote in my blog post about a month ago that it's quite likely that they all succeed, because the reason is that it's been just so successful in all the in stage 1 and stage 2. None of them have failed. That's very unusual for a vaccine, and that none of them fail. And then stage 3, generally for a vaccine, stage 3 is normally passed by a vaccine. You'd expect 80 to 90% success rate for phase 3 for a normal vaccine. But these are obviously particularly successful vaccines. Now, the reason why they're so successful in phase 1 and phase 2 is probably because of the 10 years research on on SARS. And they tried lots of different approaches originally, and some of them made you actually sicker than if you hadn't been vaccinated. But they discovered that the spike protein is the Achilles heel of this virus. And so that's why all these ones are focusing on this particular spike protein from experience with SARS. So that was why there was quite a lot of confidence it would work. And they had developed this technology for SARS, and basically they just need to snip out it's not as easy as using a pair of scissors, but I think the Oxford team, within a day or two, lots of these ones had it within a day or two, they just snipped out the SARS spike and put in the SARS-CoV-2 spike in its place, and that's their vaccine. And quite a lot of the teams had a vaccine against this already within just a few days of receiving the virus, the gene sequence, not even the actual virus, but just the gene sequence of the virus. They just used that and put it into, and they used the same gene sequence into their methods of making their thing, and out pops a vaccine. As easy as that. So that is why, really right from the beginning, they were quite hopeful. And then once they started getting the first test results, they're getting more and more hopeful. And now there's really great hope and on safety, these are likely to be the safest vaccines ever approved, assuming they are approved, which looks very likely, because they have so much safety data. The reason is that with phase 3, they did 10 times the number that they usually do for phase 3 in order to compress it into a tenth of the time scale. The more people you have in phase 3, if you have 10 times the number of people in phase 3, you get the same number of infections in a tenth of the time. And then, in addition to that, then we had these big upsurge in the United States, and these upsurges I've talked about in the United States, with one in even something getting on for more than 10 people sometimes, more than 20 people infected, then in that situation, then it's perfect for vaccine trials. And the leading ones, Astrazeneca, Moderna and Pfizer, they all had trials in the United States. I'm not sure, I think AstraZeneca actually declared its results from trials in other places, but it's got trials coming up in the United States, and AstraZeneca has a remarkable something like 60,000 people in its phase 3 trials around the world. And don't quote me on that time, you can look it up if you want to be sure, but it's something like that. And it's 30,000 and 40,000 each for Pfizer and Moderna. I can't remember which was which. So you're talking about 130,000 just with those three. And then you've got the Russian vaccine and so on. And they're all using the spike proteins, all very similar. And it must be the first time ever that you've had vaccines reaching end of phase 3 with over 100,000 people in the phase 3 trials, all using very similar technology. So they will have vast amounts of safety data to look at. Now, the emergency use will be after just the emergency use is just 2 months of phase 3, but they already have 6 months of phase 1. So you have quite a lot of data already for the emergency use. Now, emergency use just means that you go to a kind of phase 4, where everyone is vaccinated, but it's really still a clinical trial. It's not vaccinating everyone. But basically think of emergency use as being, let's do phase 4, where you will still study very closely, but instead of having a placebo group, in phase 4 everyone is vaccinated. And because these vaccines are so effective, it's very likely that they go back to phase 3 and turn it into, they've got enough data now, and they'll just vaccinate all the placebo group as well. So now you've basically got a gigantic phase 4 study, and that'll be going to hundreds of thousands in phase 4, which and over all the vaccines will probably reach the millions quite soon. And so get vast amounts of phase 4 safety data again, and that, as phase 4 continues, they look at different ways of dosing it, and they look at the safety data and so on. So before the vaccine comes to you as an individual, unless you're at very high risk in which you would want the vaccine because you know you're high risk, then so it's basically it's a risk-benefit analysis. So for very high risk people, then phase 4, because they've got high risk anyway, and then there may be a possibility of still not discovered adverse reactions. So that's where the phase 4 and emergency use goes to. And then gradually, by the time it gets to the spring, which April, when they're talking about vaccinating everyone, then we'll have 6 months of phase 3 people. So that would be like over 100,000 people. Well, it's half of that 100,000, so 50,000 are the ones that are vaccinated, because half of the placebo group, I should say. But taking into account all these vaccines, there should be 100,000 in phase 3 people, and vast number from phase 4, for the phase 3 would be 6 months of data from that. And for most vaccines, then 6 months data is adequate to pursue the long-term effects. So we will know that it doesn't have serious long-term effects by then. And the people who are working out or looking at the vaccines, then they do it the case by case. They look exactly at what precautions have they taken, have they screened against the possibility of the immune reactions, doing something of your body reacting to the spike protein, doing anything to anything else in your body. They've got to look at that. They've got to screen for that as well, and then look at that with the chemical data, the data, the clinical trial data, and all the safety data. And so far, it's the same safety as the flu vaccine. It's just minor things, nothing severe. There've been no severe reactions from any of the clinical trials. So, and that is very remarkable and because we've got such a vast amount of data from all these trials, then so that's why people are so optimistic about these vaccines. Just the accumulation of all these trials and all the safety data. So then, but then I want to explain about how we're plugging the armour how we don't need to vaccinate everyone. It's entirely possible that just the emergency use authorization will tip all these things over in the United States. Look, see, just the emergency use authorization of vaccinating key people, then it could be tipped over anyway. So I think when Biden becomes president, so just the Biden factor of that he's the president, he's following the science. So this is what you can achieve if you follow the science rigorously and carefully. That's what Jacinda Ardern did. She is not a scientist herself. She's just a politician like Biden. But she's a politician who follows the science. She listened to science, she listened to the World Health Organization. She followed rigorously what the World Health Organization had been telling us to do in January and February. And she achieved this. And Biden is going to do the same, except Biden is going to be following the United States CDC and Dr. Fauci and them, and of course paying attention to the World Health Organization. He's going to rejoin the World Health Organization. The United States CDC have a slightly different details of some of the way they think of some things, like for instance their view on masks. So he's obviously going to have very strong mask policy, but he's also going to be doing contact tracing. And the United States, Johns Hopkins University, has enormously better, completely different. They do contact tracing properly. Johns Hopkins University in the United States, probably the best contact tracers in the world. Well, they are an exemplar of good contact tracing. While in the United Kingdom, where I live, sadly, they would be exemplar of the worst contact tracing in the world, I would think. It's just really appalling the way they've done it. I'm really ashamed about the way that my government has done contact tracing. But in the United States, then they have done excellent contact tracing. But certainly some states like New York State has done excellent contact tracing, but lack of resources and lack of direction from the top. And New York State got several $1 billion from a philanthropist to support their contact tracing, I think. Bloomberg, I think he gave them a big donation for the contact tracing. I'd have to check on that. No, sorry, I must be very careful not to say things until just pop up in my memory until I check them. Maybe I should just quickly check that. We'll donate 10.5 is that billion. God, that's quite a lot, isn't it? If it was billion. But no, not sure. Maybe it's a million. Yeah, 10.5 million, yes. Glad I checked that. Yeah, 10.5 billion would be a lot. Yeah, so he gave $10.5 million for contact tracing to New York. And I'm glad I checked that. I didn't want to get you wrong. But anyway, so Biden is going to is going to really ramp up on contact tracing, 100,000 over the United States at least, and he can do quite a lot with executive orders. So it doesn't matter even if the Republicans Senate was against him. He can do quite a lot, diverting money and stuff like that. So I expect. Allocating money that's needed. So I'm expecting Biden to be able to. It's not so far he's got to push it over. I think he's going to have the cases going down already without the vaccine. And some of the states are already succeeding in that anyway. And as the season goes on, as they take it more seriously, then I expect more of these to tip over. And then with a president in charge who is supporting the states, because a number of states, even Republican states, have been complaining that the federal government is not supporting them in their efforts to fight COVID-19. So with a federal government that is supportive of the states, then that's going to help. I mean, you see Trump just off golfing and things, and with the big global meeting with the G20 summit, he left before the discussion of COVID. He just went on for 20 minutes, and then he went off golfing. So it's going to make a big difference, I think, to have a president who is really taking this seriously. So, and yeah, I just got to say, for all the Trump enthusiasts here, there's nothing to do with Trump's domestic policies. And it's like Reagan was very popular outside the United States for his foreign policies. And the controlling the pandemic in the United States, partly from there's all our friends in the United States and wanting it to be controlled for them, and it's also that for as long as you have a pandemic in the United States, it's going to be very difficult to get rid of it in the rest of the world. But luckily, the United States is going to be one of the early people to have lots of vaccine. Same in Europe, and it's actually very, very fortunate the way it's worked out. That it turns out that just about all the really bad hotspots in the world are either they're very wealthy, like the United States, United Kingdom, Europe, Japan, which isn't really a bad hotspot, that's got to be reasonably well controlled, but or they are there's the vaccine producers in India, so India isn't such a wealthy country, but it is very noted for producing vaccines, and it's going to keep half its vaccines for its own population, which is understandable and acceptable. And then there's places like Brazil and Mexico. Mexico's many bilateral agreements, and Brazil has got its own factory for making vaccines, and it's got permission to make Astrazeneca. So it's got a very big factory they made a decade or so ago for making vaccines, because vaccines are very important in Brazil because of all the diseases they need to be vaccinated against. So Brazil has that capability, and then South Africa, and so it's because of that. Then by spring to summer next year, then just about all the worst hotspots in the world, and Russia of course, just about all the worst hotspots in the world will be getting over their pandemic through vaccination, and they'll be able to vaccinate they'll be able to vaccinate everyone who wants to be vaccinated by the summer, sometime around the summer, but they can control it much faster than that. So that's the explanation about how it plugs gaps. So this is my graphic. 20% of the world, so that's meant to show the world roughly just by divide 20% to 80%. 20% is already virus-free. They have like really excellent armour. So that's 20% of the world. And then 80% of the world has not very good armour, like they've got gaps around the eyes and stuff. And then they've got these great big holes because the parts of it they're just not doing properly at all. So that would be like not washing your hands, that would be like not physically distancing, not wearing the masks properly, and so on. So they've got great big holes, and then it doesn't cover you totally either because they have certain things they're just not doing. So if you're like that, then the vaccine can help. It's like a little plaster, it's like a sort of extra armour that can cover all the gaps. So you don't need to vaccinate everyone. Very targeted vaccination of the gaps is what can do it. So I had an example there of Leicester. There we are, Leicester. So Leicester in the UK, that's a city of a bit over 100,000 people. Then they had a lockdown in the summer, but it wasn't quite enough. And Leicester still got an outbreak there. And now, if the UK had a vaccine there, then in the summer they would be able to vaccinate everyone in Leicester. 100,000. It's only 0.5% of of the UK population. So then out of that, you can do that much earlier on than you can vaccinate everyone. So if you start getting just small areas with like 1 in 100 or even 1 in 10, so in the United States, once it goes down, and you go and say, oh well, there's wherever it was, North Dakota down there somewhere, 1 in 14, you say, look, most of North Dakota, there's 1 in 10, 1 in 20, nearly all North Dakota is less than 1 in 20 infected, more than 1 in 20 infected. So basically North Dakota, which is quite a small population compared to the United States, then if it was like that, after it's brought down a bit, you could vaccinate all of North Dakota if they're interested. So if you can target small areas, our population of North Dakota, it's quite small. That's why they got it late. Population. The rural areas, which people tend to not avoid, are 700,000. So that's less than, out of 300 odd thousand. Then sort of 2%. No, 0.2%. See, so I mean, just supposing, and this is just a suppose, population of so suppose, for instance, that it's not. I'm not saying this will happen, but suppose it was gone everywhere in the United States and managed to control it effectively, and only North Dakota, which is being very resistant, they've got a governor who's just not doing anything, and that's why it's kept going up. People someone in the group from North Dakota, he says, our government is just not doing anything to stop COVID, and so that's 0.2% of the US population. So if North Dakota ended up being the hotspot, that just for one reason or other, then they're still the worst area. If they're the worst area in say February or something, then you could vaccinate everyone there, and that would still be only 0.2%. So you could do that early on, long before you can vaccinate everyone in the United States, but it's likely not possible until April, or going through to the summer. So you can do that, and then you can also vaccinate particular groups. So first of all, you can bring the death rate way down, and by vaccinating, so you can remember, a vaccine doesn't protect you 100%. Even the best vaccine, the Pfizer vaccine and the Moderna one, you talk about 1 in 20 will still get it. So if you've got 1,000 dying every day, then if you can vaccinate 20% of those people, vaccinate all of those people, then that will bring your 1,000 down to a 20th of 1,000, which is 50 dying every day. Yes, 500,000. So you'd bring the deaths down to 50 per day, but you wouldn't bring it down all the way until you've got enough to stop it actually spreading. So now if you're vaccinating in a care home, you can stop it spreading through the care home, vaccinate all the workers, then that means that a little outbreak in a care home won't spread so much. And so that protects all the residents in the care home that if you do get an outbreak, it's only going to be 1 or 2 get it. And it won't even spread to all the 10%. You can stop it even faster than that. And if you have, the more people are vaccinated, then if you vaccinate outside the care home, but then if you add that onto proper personal protection equipment and everything, so that's how you don't just vaccinate the vulnerable. You've got to vaccinate the frontline workers as well. That's very important, like the workers in the care home, and all the nurses that visit the care home, and all the doctors that visit it, and anyone who's got any contact with it, and the caterers and the cleaners and everything. And they continue doing their ordinary protection as well. So, and then same in the hospital, and all the frontline workers need to be vaccinated, and so, and then you get all the elderly, but then you also going to have targeted vaccinating of places where it's super spreading. Then it's not going. You've got your 1,000 deaths a day. Then if you vaccinate all the vulnerable, it goes down to 50 a day. But then it's going to be like this is going to be going down as a result of the vaccine. And so it's 50 a day, and then it's 40, then it's 30, then it's 20, and then it's 10, and eventually they're all gone, and there are no deaths a day. So that would happen even when you're long before you're able to vaccinate everyone. So I think that's important to realise. And we have that so that's basically the main thing I wanted to say here. And so this can be achieved without a vaccine at all, or if you've got somewhat battered armour, but you've still got a fair bit of it, then you can get here by keeping up everything else. But you've got to keep up everything else. So that's why, this is why they say do it all. If we only do the vaccination, and we were to stop doing everything else, to give up the max testing, give up the physical distancing, face covering, contact tracing, and hygiene, everyone just relaxes and goes back to normal, and they just behave like that. But with the virus still circulating in the crowd, and all they've got there is a vaccine, then it'll have to wait until it ramps up all the way until you've got nearly everyone vaccinated. You would get more than something like 78% vaccinated at 90% efficient before you can control it just with the vaccine. And even then, it's only going to be now not just a little bit less than one, and it'll just go down gradually over months and maybe even years. So so if you just hit exactly the herd immunity, then it would go on indefinitely, to go a little bit over. But if you do everything else as well, then you can get back to this point. So then we can have, so I think with Biden as president of the United States, that's going to accelerate it there. In the United Kingdom, then we are not doing contact tracing very well, but we are doing some other innovative things, like we're doing the mass testing of lots of people. And we have this new idea of doing the testing every day of someone who is a contact. Now, that is not nearly as effective as quarantining, but it will reduce the R0, help reduce the R0 below 1, which is the main thing we need to do, which start going down. And it's not effective testing every day, because if you test negative one day and you test positive the next day, and all you know is that somewhere between the negative day and the positive day you were infectious. You don't know when. It could be immediately after the negative test. And also this mass testing misses out 1 in 4 of people who are positive. So it's obviously not going to, it's not nearly as good as quarantine, but this new idea in the United Kingdom is going to help if you do get the uptake, it is going to help edge the R0 over. And then the mass testing lots and lots of people and discovering even asymptomatic people with who would probably be pre-symptomatic, some of them, and that's going to help as well. So when I said United Kingdom sadly is useless on contact tracing, but it has been quite good on some other things there, especially recently. So it's not all gloom here either. I mean, in fact, it's not gloom at all because of the vaccine. But the sad thing is that we just didn't need we didn't need any of this. We could have stopped it without a vaccine. If the world had listened to the WHO in January or February, then none of this would have happened. And even if you listened to them on March, it's just so sad. I was just so sad on March when the UK moved from the contained to the delay phase. And then during the lockdown, when they didn't do any tracing. But at last, things are beginning to move. And hopefully, we begin to see this turn around. And well, we will do. We definitely will with the vaccine. But for you as an individual, then what you've got to do is to keep doing everything. And hopefully I've reassured you that the vaccine will be safe. They're not going to approve it unless it's a very safe vaccine, and they have vast amounts of safety data. So it's they will be able to assess it very, very well. And so the emergency use authorization is going to be a risk-benefit analysis for people who are, at the front line and so on, and then they will work through the, and so basically phase 4, and then they will be doing the proper approval, and they'll gradually work through that, and then it's up to the World Health Organization, the CDC, for the individual countries to go through the proper regulatory approach, which they do for any vaccine, and then whether they will say, does it need to look at each individual vaccine, look at it individually, and decide, does this need 6 months more data, or does this need a year data? So for some of these, what's that about? Oh, that's just my Windows update. So some of these are, I don't think it's one in phase 3 yet, in clinical trial yet. Or it was adjuvenated, but that's okay if it's a known adjuvant. But there are some that are, what's the word? I can't remember. Oh yes, but I'll just mention one more thing while I'm here. Then we have Vaxart, and we also have Symbio, which are oral. So those two vaccines, then they can be taken as a tablet and be very useful for someone who has needle phobia, and it will also be very good for people, and very good for people. A lot of people who are concerned, anxious about vaccines, and maybe to a certain extent it's actually needle phobia, and whether or not there might be a bigger uptake for tablets, because also if you believe the conspiracy theory about injecting nanoparticles, nanochips into you to reprogram you, it's a ridiculous idea, but it doesn't make any scientific sense. But people who are scared of that might be less scared once they realise they can take the tablet. I also get people saying, oh, I don't trust the United States vaccines, but I'll take one from Russia. So since we've got vaccines from all around the world, then if you trust Russian vaccines over the United States ones, then maybe you'll be able to get your Russian vaccine or the Chinese vaccine. Anyway, some quite eccentric views. I won't. I know some of you seriously think this, so I don't want to say anything like that. But yes, we need to be respectful to people. But really, there's I think as time goes on and you get more and more data coming out, it'll be clearer and clearer that this is a really safe vaccine. And yeah, so what's the other one? Attenuated. That's what I've got to look for. Is it able to simulate concept for some reason? Anyway, there's a couple of attenuated vaccines. I don't think it's able to search for some reason, or I mistyped it. Anyway, there are a couple of attenuated vaccines down there. Maybe they're not. Maybe in preclinical trial, but they with an attenuated vaccine, you'd normally need a longer period, maybe a year. But again, they would decide case by case, vaccine by vaccine. They're absolute experts. They always involved in pre-approving in order to help countries to, the first stage is often the WHO pre-approving or I can't remember their word they use, looking at the vaccines first. So they're going to be very, very well looked at. That's the picture without any of the text of this. So you can expect to be like that. Once, probably sometime in spring to summer, it can be several months earlier if you do everything else, then the United States can be back like that. And the virus will be gone, and you'll just be talking about incoming outbreaks. So that's the situation. You could be back to, and New Zealand did theirs pretty quickly. If you think about, like 150,000, it's getting on for 200,000 a day cases in the United States now. But if you're reducing tenfold every 3 weeks, then in 3 weeks that's down to 20,000 a day, another 3 weeks down to 2,000 a day, and that's just 6 weeks. Then after 9 weeks, it's down to 200 a day. After 12 weeks, 3 months, it's down to 20 a day throughout the entire United States. And after 15 weeks, then, it's close to gone, if you were to do it as effectively as New Zealand did it. So it is entirely possible if they would start now doing what New Zealand did in November, and what's it, 15 weeks, so that's 3 months and a bit, then December, January, February, and sometime in March would be like this. Now, so add a vaccine to the mix, and then do it maybe not quite as effectively as New Zealand, then I think again something like March would be achievable for this. With the vaccine, if you did a reasonably strong response in the United States. So they're not all vaccinated. None of these people. The thing to bear in mind is none of these people are vaccinated. The vaccine doesn't even exist in October. And yet they're totally safe from COVID-19. Millions of people around the world, a fifth of the world population, is totally safe without a vaccine. So you can be totally safe with a minimal vaccine. It doesn't have to be an island. The United Kingdom is an island, so if there was an island advantage, the United Kingdom could be like this. But it isn't, because there's Laos, and there's which is in the surrounded by countries. There's Vietnam. There's China, of course. So it's not just islands that can do this. The entire countries that are surrounded by land borders have also done this. There's absolutely no doubt at all the United States could be like this if it were to do as effective a response as New Zealand did. So without a vaccine it could be like this if you really, really do things systematically, ramp up, if both the government and your people so really get behind it and do these things properly. So it's wearing a mask, but if you all do it, then it's not for a very long time. If only one or two, if most of you don't do it, you do it half-heartedly and you don't do the physical distancing, then it goes on and on and on and on and on until you're all vaccinated. So do continue to protect yourself. So yes, as Mike Ryan put it, I'll just finish with this. As Mike Ryan put it, then, for instance, he was talking about quarantine at that point. Then, if you are a contact, and if you quarantine properly, then you are going to be the end of the virus. It stops at you. It can't go any further. If you don't do the quarantine, if you're infected, then I'm not sure if he was talking, maybe he was talking about all the measures. I have to look up. But it's the same for quarantine, same for everything else. Then you are the start of the vaccine. So you are a superhero. If you go around doing these things, so I think quite rightly said, all of us are superheroes. If we go around doing this, if you're doing this properly, you're doing the physical distancing, you're doing the face covering, then that means that the vaccine is stopping at you. The virus, it never gets to you. So you are the end of the virus. Oh yes, another way they put it is that as soon as the virus goes into a body, the body starts fighting back. So at that point, the virus is not, there's no mind behind the virus. There's no thinking there. It's not got a plan. It's just a chemical, biological entity. It's not even a living cell. But if you could imagine, if you put how it's thinking, which it isn't, but the evolutionary thing that's evolved to do, is that as soon as the virus is in your body, as soon as your body starts fighting back, if your body doesn't fight back, the virus is just happy, it's just going around your body doing its thing. And so the most effective virus is one that doesn't harm your body at all, because it can just sit in your body and your body doesn't even need to bother to fight back. Maybe eventually it becomes a symbiote and it's used for digestion or used for some process in your body, we have quite a lot of symbiotic, I think it's symbiotic, I'll search that up. I won't say that until another video. But so your virus is, I could do a search for no, but it's going on, got to now, I'll stop. So anyway, the virus is, if the virus, if you could imagine it having a mind, but it doesn't, but once your body starts fighting back, then the virus's thought is, I've got to get out of here. I've had it. This body is going to, it's defeated me. And it's actually gone before. These people, the worst case stages of the often the virus is gone, and it's just the effects of the body fighting its own immune system. But the virus says, I need out of here, so it's got to find someone else. So if the other person is trying to find is you, and you are doing this physical distancing, you've got your backpack on, you're your superhero, you're wearing your mask, you're physical distancing, you're Spider-Man, and you're doing everything right, doing it all, then the virus can't get to you. So you are the end of the virus. Now, if you don't do all this, you're not wearing a mask, you're just close up and just not paying any attention to any of these measures, you are the start of the virus. The virus hops to you, it says, oh good, I found another body, this one has finished with me, I found another body. It then starts replicating you, then it'll head off. And then you're starting a new infection chain. And then, a couple of months down the road, that could be 100 people infected because you didn't stop it. So that's why that's why it's just so important to do all this. Not just for you. If you're young and healthy, there's not necessarily, there is 1 in 5 risk, 1 in 45 risk of long COVID, and 3 months later you're still sick over this, and that's not nice at all. You really don't want long COVID. To be at home and you just an awful lot of work just to walk down to the shop. You get breathless going down to the shop, and your mind is fuzzy, and you find it difficult remembering things from 1 minute to the next. And that's not nice. And there's it's only a few percent chance, a couple of percent chance or something, 1 in 45, 2% chance or something. But you don't want to have long COVID. But as well as that, you want to be the end of the virus. So stop it. Just don't let the virus get to you. And then make sure that other people know about this toolkit. And stay informed. And I strongly recommend following the WHO social Q/A, because they're really excellent. Every week, I think it's Wednesday, there's a Q/A. You can use hashtags to ask questions yourself, but it's not like the media briefing. I watch the media briefings as well, but they're rather technical and they're rather political, and the journalists ask very political questions, and it's really a bit dense. I don't really recommend that to others because you need quite a lot of patience, and you need to have a little bit of technical background of just general science kind of background. I mean, not necessarily I've got no background in biology, medicine, but just the general scientific background. Then if you have that, then the media briefings are excellent as well. But but they tend to focus on different things from the ordinary person's daily concerns. So the questions that are uppermost in everyone's minds, then I strongly recommend the social Q/A of the WHO. It's really excellent. So that's me finished. That's me said everything. And I might do a shorter video of this. But I know some of you like long videos, so I'm doing a long video. And then just reminder that the Doomsday Debunked is a great place. It is I hope it's a place that people find very helpful, for Doomsday Debunked group on Facebook, to help you with your fears about all sorts of things, and both for people who are expert and for people who are scared, and also ordinary people who are good at reassuring people, then and people who are just good at, and then people who are just, like me, who are just good at fact checking and following the science, and we recommend any of that. So do please join if you want to help scared people, or if you are one of the scared people, be sure to read the rules at the head of the group if you join, because before you post or comment, because they help to make it run properly. So, hope you enjoyed this, and thank you very much. Hope you enjoyed this. It's a bit of hope, I think. We get so much gloom, and there's a big gleam of hope here. And this is not me, this is what the World Health Organization is saying. And I'm just, the World Health Organization is saying that we've got a lot of hope with the vaccine, but they're also saying we've got to do it all. And that doing it all will bring the virus down, and then the vaccine will help bring it all the way down. And they said we've got to do it along with the vaccine. So we mustn't stop doing all this once we've got the vaccine. We've got to do it all. That's the important thing.